All right. Hello to all our listeners. Happy holidays. A wonderful time of year, unless you're a parent, and then it's a busy time of year. A lot of stuff to do as an adult in the holidays. One of the really great things we get to do over the holidays, though, is spend a lot of time with family. Multi generational, your parents, your grandparents, they get to see their grandkids, all those great things. And a lot of times it's a really good time to have some discussions that sometimes families avoid because you're all in the same place, you're all in good spirits. And it's important because discussing care at the end of our life or of loved ones is really never an easy discussion, but it's an important one. Dying is, after all, a universal experience. It's not a discussion we're having enough. And surveys completed by the AARP show that 85% of adults who are over 45 say they're comfortable discussing death and dying, but 7 in 10 say the topic is generally avoided.
There are teams of people who actually specialize in not only end of life care discussions, but pain relief and quality of life in patients who have serious illnesses. Today, we are joined by one of those team members, a palliative care specialist. We will discuss those often avoided discussions to help clarify some of the confusion people have about serious illness care.
We are your hosts, Dr. Cari Sorrell
and Dr. Jessica Gray.
Welcome to the Med Podcast.
Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit Podcast. Today we are joined by our friend and colleague, Dr. Brittany Dawson. Dr. Dawson is certified by the American Board of Internal Medicine in Internal Medicine and Hospice and Palliative Care Medicine. She currently participates in inpatient palliative medicine encompassing pediatrics and adult populations in the Covenant Hospital System here in Lubbock, Texas. She's a native of Alabama with a bachelor's in science from Howard University and a doctorate in medicine from the University of Alabama in Birmingham. She went on to complete a residency in internal medicine at the University of Tennessee Health Sciences Center in Memphis, Tennessee, and a fellowship in hospice and palliative medicine at Texas Tech University in Lubbock, Texas. She is the mother to 3 children and spends the majority of her free time coordinating their social lives. She makes the goal of her practice to ensure that patients and their families are empowered with the knowledge to make informed decisions with their care and health and ensure that they are treated with dignity and compassion even at end of life. Welcome to the podcast, Dr. Dawson.
Good morning.
Now, your job as a palliative care specialist requires you to wear many hats. And I know this because I've seen you do it in the hospital multiple times. So first, describe to our listeners, what does a palliative care physician specialize in?
For sure. So majority of what our care is centering on making sure that people have the best quality of life. And so especially while they're receiving aggressive treatments or taking care of other medical issues. And so we do a wide range of things from pain and symptom management with nausea, vomiting, agitation. We also do goals of care conversations. And so, and we help with advanced directives and medical power attorneys too.
So this is one of the definitions that I feel like patients and family members or lay people really often get confused and have questions about. But what is the difference between palliative care and hospice care?
So that's probably a question I get every day. And so I tell people the really big difference is that hospice care is very focused on a very specific time in a patient's care. And so it's usually when someone has a life-limiting diagnosis with an expectation to only live 6 months or less. And then their focus at that point in time is purely quality of life. We're not thinking about doing any more aggressive treatments. We just want to make sure that patient is comfortable and they have dignity with the last days that they have. Palliative care, however, is for patients who have a life-limiting diagnosis of no specific time frame. It could be early diagnosis on, and we're providing that same type of quality of life care, but also helping them navigate the healthcare system as they have to make decisions along the way for their care plan.
A lot of people think that you just deal with cancer, for example, but what are some other diagnoses that you help manage with for not necessarily the last 6 months of their life, but like you mentioned, early to late diagnosis?
We actually take care of a wide variety of diagnoses that are not related to cancer. And so some examples are end-stage renal disease on patients who are on hemodialysis. We care for patients with coronary disease, peripheral vascular disease, COPD or emphysema, and pancreatitis and liver disease patients also.
Okay. And I know that you're not just asked to see patients when they're actively dying, even though some people have that misconception. But really, when is the best time to involve a team like yours in a patient's care? When do providers know that that's their next best step?
I usually tell people even at earliest diagnosis. And so some of the early things that we do is more so talking about, okay, these are the things that are going to happen and these are decisions you're going to have to make. And these are the people that are going to be part of your care team, and just getting people to understand what their diagnosis means. What we realize a lot of times in healthcare is that we tell you you have a diagnosis and people have no idea what that means for life moving forward. And so some of what my job is just to kind of explain, hey, these are some of the changes you may happen. These are the people you're going to have to work with. And sometimes it's helpful to have that earlier on so that way we don't go back and forth from the hospital to doctors and navigating systems because we don't understand how that changes our life.
Yeah, and I like that you mentioned teams because most of the time palliative care specialists work in a team because of the complexity of these situations. And I've seen your entourage in the hospital that follows you around. So who's usually included on your palliative care team?
Our team consists of usually physicians, nurse practitioners, but we also have case managers that help with social issues. We have chaplains that assist with spiritual care. We have pharmacists that kind of help navigate the multiple pharmaceutical medication management that you have with these patients. And so even some teams that some places have the addition of counselors that can assist with support for families too. So we have a large group of people that work with us on our teams.
I love that. I love the team-based approach to basically everything in medicine. I think it's absolutely essential. So earlier we referenced a similar statistic, but there's another one that looks at a 2018 survey completed by the Conversation Project, a public engagement initiative of the Institute for Healthcare Improvement. This project showed that 92% of Americans say it's important to discuss end of life care, but only 32% have actually had this conversation. And I know this is something that we as physicians often counsel our patients on, that the holidays are the best time to have these conversations because it's the time that you're actually in the room with family members. Sometimes you're feeling nostalgic. Sometimes you're having these, walk down memory lane. And then you sit there and you have someone like me go, "Hey, mom, so have we talked about what we're going to do if you pass away? When you pass away?" And mom looks at you like mortified. How could you just ruin this entire day and moment by bringing up such a morbid conversation? But we want to be able to encourage people to have these conversations. When asked about barriers to these conversations, things were mentioned, even such as lack of training, culture, lack of knowledge. They were all cited as reasons why people said, okay, I'm having trouble getting that conversation going. So, as our expert in end of life care, all of those things that we really want to have those conversations in, when and how do you think it's the best time and the best way for families and patients to bring this topic up? So you don't have a reaction like mom might be, where, how dare you ruin Thanksgiving? Also, are there these same barriers that you usually see having these discussions? Or is this the same ones that the statistic mentions? Or are there other barriers, and how do we address that?
So you're right. I mean, those barriers are definitely present, even in these crisis situations that I sometimes am coming into. And so I tell people the other barrier is this fear that if I talk about it, that means I'm going to make it real. And so I tell people the reality is that the scariest thing is getting in that situation and having no idea what to do. And how to navigate it. And so most commonly what I tell people is, like, when you hear that your loved one went to the doctor, say, hey, you went to the doctor. Hey, how's your health? Have you thought about these things? I've also recommended people, there's copies of advance directives and medical power attorneys and all that available on the internet. And so just print them out and give them to them and say, hey, I found this the other day. Do you have one of these? Have you completed one of these? Especially when people start talking about financials, that's a way to kind of throw in some of these conversations too. When they start telling you, oh, I have these accounts. I was like, oh, well, do you have something in place about what happens when you're not here to manage these accounts? Do you have someone else on those accounts? And so sometimes those can be just little ways to sneak in and bring up these conversations that are very heavy topics, but at the same time, very influential things that we need to know about people's lives. I really encourage loved ones to talk to family members that don't have adult children, because those are the people that see most commonly in the hospital setting that we really don't know what they want or what to do and don't know who to talk to. And it's because they just don't have the normal kind of, I got these kids who are just going to take care of me, these aunts and uncles that really we haven't thought about that. So please do encourage them to have these conversations. It's very important. It's something that will help you, but also help them make sure that we respect their wishes.
No, that's a good point. I didn't think about that, but you're right. Adult children are usually the ones that end up having to address these things. If you don't have them, you may not have an advocate. And I think you kind of touched on the important points. So, health, finances, the social part of it. I think those are really the ones that you are urging people to discuss, in whatever setting they feel comfortable. Now, say you're in the hospital setting, okay, and you're seeing the patient in the hospital. or they're sent to see you in clinic, what resources do you usually suggest in helping plan and document these patient wishes? I know you mentioned a few online, but are there any specific websites you recommend or any resources?
If there's a specific conversation about whether someone wants to be a full code DNR, Texas has a website for which you can go to that specifically has those documents that you can print for home settings. Five Wishes is a common one that we use for advanced care planning that talks about would I want a ventilator, would I want IV fluids, would I want a feeding tube. And so that's a good website to look at that kind of gives you a way to walk through that conversation. I tell people if they want more complex things like I have an estate planner or things like that, then you really do have to go to like a true lawyer to kind of set up those very complex financial situations. Mm-hmm. But for someone who just wants to start a conversation about it, the Five Wishes is probably the most common website I've recommended people to.
Great. That's very good information. We'll include a link to that website in our show notes. And overall, I know these are things that people don't feel comfortable addressing, and sometimes you have to think of unconventional methods to broach these topics. I actually saw an article previously that was written by a palliative care doctor. It was really interesting. He talked about how David Bowie's last album, which he wrote and performed and recorded when he knew that he was dying, it's called Black Star. It actually, he used a lot of lyrics from this album to broach topics with people of a certain generation who were big David Bowie fans. He did die 2 days after he released this album from liver cancer. So sometimes a straightforward approach isn't always the necessary one. And so really you kind of do have to think about, like Jess said, so you don't get the response of, where are we talking about this? Maybe relating it to someone either famous or not that they know and why, that situation shows how important it is to have this discussion. I wouldn't say this is a depressing topic, but it's not the most sunshine, roses, happy feeling ever. So why don't we switch gears and talk about something a little more jolly, maybe? Since we're in the holiday season, we're going to talk about some interesting holiday health facts. So Dr. Dawson, just sit back and enjoy listening.
I love this. Happy holidays, everybody. So first up, we are going to talk about calories. This one shocked me a little bit. So according to the U.S. Department of Agriculture, the average number of calories a person eats on Christmas Day, I think I need a drum roll sound effect or something here. So is 6,560 calories, which is, by the way, 3 times the recommended daily amount we should be having for intake. That's crazy. I think it's because we just sit there and just eat and eat and eat and eat, right?
It's like every event, party, work thing you go to is all food.
Oh my gosh, I know, which is fun. I mean, food is part of, it's in the United States, it's part of our culture, right? We have a lot of food that revolves around, mealtime, getting together with family members, but we just gotta maybe think for a hot minute about that because in case you want to keep track, calories in just one non-alcoholic cup of eggnog is 350. So, you just have one cup, you already hit 350 calories, it just keeps going and going. And we want you to be able to enjoy the holidays, right? Just maybe we just don't have to overindulge. Because I think one of the things I always tell my patients is that they can enjoy things on Christmas, on Thanksgiving, whatever that holiday is, but we don't have to live in the season of endless consumption where people bring cookies into the office and everyone drops this off and it's the kids' holiday party at school and you're just eating calories nonstop because that 6,560 may not just be reserved for Christmas Day anymore. Now it's basically every day.
Yeah, and that's hard to burn off.
Yes.
So just keep that in mind as you're enjoying your holidays. One of the fun facts that I got a little bit of a chuckle of, even though I don't like anybody ever getting injured, but apparently about 1,000 people are injured by their Christmas tree every year.
Their Christmas tree.
Usually while fixing decorations to higher branches. So when you are doing that, make sure you have a spotter and stay safe on those ladders, guys. Don't be one of the thousands that gets taken down by their Christmas tree.
I think our orthopedic surgeons would absolutely love that conversation there, right? Yeah, making sure there's a lot of ladder safety that we need to talk about too. I mean, if we had a whole episode on how to do this all the correct way, because I didn't realize this, there's a lot of ways you're supposed to actually use the ladder and which steps you're not supposed to step on. But go to talk to somebody or look that up if you're doing it all by yourself.
Yeah, and don't let your grandparents get on the ladder to the tree.
No, okay? Yeah, don't be too cool to ask for help either for those top branches. Another stat that I don't love over the holidays, but it's quite shocking, is that the risk of having a heart attack is a whopping 37% higher on Christmas Eve. That's peaking at 10 o'clock p.m. So I guess that's just when the stress levels from all the family all together just really peak, and all that extra food consumption, everything just must hit, and there's a lot of cardiac events happening right at 10 p.m. on Christmas Eve.
Yeah, we talked about this a little bit later about why there's some more cardiac issues over the holidays, but we do see a lot of heart attacks over the holidays. Going back to some food related medical trivia, because ultimately, like we talked about, this is the most important part of the holidays. It is estimated that approximately 400,000 illnesses each year are caused by eating spoiled Christmas leftovers. So refrigerate appropriately and throw the deviled eggs out. Or
yes, first thing I was thinking of anything with mayo. Anything with mayonnaise. You have to know that you have like 1 hour of it being out of a refrigerator, sitting out on the countertop. Like, know these things.
Yes.
I will say it's really funny. The CDC has a good social media going right now. It's really funny. I think post COVID, they kind of stepped up their game, and they post all sorts of fun holiday related facts. And some of this relates to spoiled food and how long things can be out. So if you're just, perusing social media, add like the CDC for fun, and they can give you some good information. What also is helpful is they post all the things that talk about what foods are on recall right now for salmonella, things like that. So if you're sitting there and you're like, I'm going to make this beautiful berry salad thing for Christmas, maybe just double check that it's not the time that, the strawberries are the culprit at the moment. But another thing, talking about the CDC, a positive fact from them is that suicides traditionally have not peaked over the holidays. And December is one of the lowest months for suicide across the country. Obviously, that's a very triggering subject in general, but it is something to consider because I know a lot of families really struggle with their first holiday after the loss of a loved one. And so Christmas can be a really big reminder of, hey, this is the first time that I'm not here with, or mom's not here sitting at the table with us. But make sure you lean into the rest of those family members and know that they're here for you. And I'm glad that that statistic is actually lower during this time.
Yeah, because I feel like I always was traditionally taught that it was higher over the holidays. So I was interested to find out that was the case, and it is very positive.
I mean, you'd have thought with all the stress levels that, but we're making it, guys. It's all that extra calories that keep you feeling a little bit better.
Some carb happiness, maybe.
Yeah.
All right. Well, I'm about to give you some really good trivia to throw out at your holiday party with friends and family. So just so you know, the fear of reindeers is referred to as chionophobia. And I'm so sorry if I mispronounced that, but that's what it is. And the fear of relatives, speaking of relatives, is called meliagrissophobia. I feel for you if you have either of these phobias this holiday season, and hopefully you can pronounce it better than me.
I love it. I think we all need a little bit. That sounds like something that my little toddler or something's going to tell me about, right? Okay, so I'll pick. I'm going to one up your holiday medical trivia here. Holiday heart syndrome is a sudden arrhythmia or irregular heartbeat caused by stress, dehydration, overconsumption of fatty meals filled with salt, higher than usual alcohol, and caffeine intake, or a combination of all of the above over the holidays. But it is definitely a real syndrome, and I know our cardiologists, if they were on today, would have lots to say about it as well.
Yeah, and I think that's where that just increased, heart attack risk also comes from.
Right.
Reasons, really, it's just our diet is extreme, as we have mentioned, and sometimes our alcohol consumption is extreme as well, and that can trigger people who already have underlying, predilection for heart disease. So kind of one of our last stories we'll tell for our medical trivia. So everyone knows who Tiny Tim is, right? The crippled son of Ebenezer Scrooge's clerk, Bob Cratchit, in A Christmas Carol. And, Dickens talks about him being ill, but he never really states what illness Tim suffered from. And there's some controversy on this topic.
Oh, really?
I realized when I was looking this up online. But because of Tim's short stature, his, asymmetric or one-sided crippling disorder, and his intermittent weakness that ultimately would lead to his death if untreated within a period of 1 year, many historical scholars believe that Tim may have suffered from renal tubular acidosis type 1.
Oh, this does feel like a medical school throwback,
yes,
right? Yeah.
Right?
Mm-hmm.
Yeah. A disorder that's characterized by growth failure, and if left untreated, of course, some softening of the bones, fractures, low potassium causing muscle weakness and sometimes paralysis, calcium in the kidneys leading to renal failure and then death. If you look at medical texts from the time, his recommended treatment plan would have included country air and exercise.
Oh, I love that.
Fish oils and tonics that likely contain belladonna, opium, maybe some bicarbonate, some sodium citrate, potassium chloride, and then, of course, splinting and bracing the limbs.
It's very adorable to know the Christmas Carol story has this whole medical background.
Exactly.
Mm-hmm.
But interesting facts we have discussed on what I have termed our holiday hype segment. So we'll leave you with a little joke, hopefully a chuckle. Yes. What do you call a sore throat from eating a Christmas ornament?
Did you say, what do you call a sore throat from eating a Christmas ornament? Okay, I have absolutely no idea.
Tinselitis.
Oh, okay, that's cute. I feel like it's a dad joke right there,
Yes,
Cari.
total dad joke. That's one for your kids. I think that they'll appreciate.
Absolutely. Well, thank you guys again so much for joining us on this episode, our holiday episode. Thank you, Dr. Dawson, and all your helpful insight. I know that this is one of those things that it's a hard conversation to start sometimes, but the holidays are a fantastic time to sit down. Maybe after that couple glasses of eggnog, you can start this conversation more readily, just preparing to know that this is out of all the love in your heart, but we want to be more prepared through these conversations. Don't forget, if you're a listener claiming CME credits, please look in the show notes for instructions.
And for all our listeners, thank you for tuning in. Please like, subscribe, and share this episode. Let us know what other topics you're interested in through our Instagram, and stay tuned for the next one.
Thank you for listening to the MedEdit podcast. Please click the follow button to be notified when new episodes become available. For more information about this episode, and to learn how you can reach Dr. Cari Sorrell and Dr. Jessica Gray, please visit today's show notes. And don't forget, click that follow button to be notified when new episodes become available. The information and content has been made available for informational and educational purposes only and does not constitute a physician-patient relationship. If you need medical advice or help, contact your personal physician. The views and opinions of the guests do not necessarily represent the views or opinions of Dr. Jessica Gray and Dr. Cari Sorrell. This podcast should not be considered as an alternative for medical advice, diagnosis, or confirmation of an illness or disease. Please seek assistance from your personal health practitioner.